Welcome everybody. My name is Melanie Escher-Blair, and I'm with the Arizona Telemedicine Program and the Southwest Telehealth Resource Center here in Tucson, Arizona. This is the first of a series for occupational and physical therapists. So this is session 1, and it is building relationships and rapport with telehealth. So we have a material handout link I'm going to go ahead and put into the chat. We've got a lot of resources on this link. You'll be able to click on it and you'll see the copies of the presentations of our presenters, plus a bunch of other information and handouts and PDFs from various resources and citations. So again, welcome. Of course, the Southwest Telehealth Resource Center, our region states are Arizona, Colorado, New Mexico, Nevada, and the Four Corners area. Welcome also anybody who's a HRSA grantee, all of our occupational and physical therapists from across the nation, and all of our other participants. So at the University of Arizona, I'd like to read our land acknowledgement. We respectfully acknowledge the University of Arizona is on the land and territories of Indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the O'odham and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through education offerings, partnerships, and community service. So as you were logged in today, just to let you know that the phone and your phone or the computer microphone was muted, we will be using the chat feature. So please, if you have any questions, go ahead and click on the chat and go ahead and put your questions in there. We also have the post-webinar evaluation and the CEU request. It will populate in a separate browser window, but I will be putting that URL link into the chat as well. This session is being recorded and it will be posted on our website so that you can review at a later date. There won't be CEUs available for watching the recorded version, just the live version this evening. So if you have any technical issues, you're welcome to put a message into the chat. We have an email address, we have a phone number you can call. This is the continuing education information. The educational level is introductory. We've got some learning outcomes. All this information was also on our registration form. I won't read through it, but we are accredited by the American Occupational Therapy Association for 0.1 CEU and by the American Physical Therapy Association Arizona chapter for 1 CEU. Your opinion is valuable to us. Again, please remember to do the evaluation and to access your CEU credit requests. It will populate, like I said, it will populate in a separate browser window, and the URL link will be shared in the chat. Also, check our website for upcoming webinars and trainings. Next Tuesday, we have session 2 of our series, and it's physiotherapy quality care via telehealth and video conferencing with Luke Davies, who has a doctorate in physical therapy from the University of Melbourne. It'll be a fascinating session with him, and we've got some more information on our website about that. So I'd also like to quickly say a shout out to my planning committee that helped put this whole series together. First, starting with Dr. Krupinski. She's my mentor. She helped guide me in what I'm doing. And then I was able to reach out to Mary Schmitz and Peggy Stein. Peggy Stein, who's on with us, will help some questions later. Those are my 2 occupational therapists, and my 2 physical therapists, Dr. Alan Lee and Christina Crawford. Thank you again. I know they're in the background watching as well, but that's my planning committee, and it's been wonderful working with them putting this together. All right, so first up, we will have Dr. Elizabeth Krupinski. So Dr. Krupinski is a professor at Emory University in the Department of Radiology and Imaging Services. She is our Associate Director of Evaluation at Arizona Telemedicine Program and the Director of our federally funded Southwest Telehealth Resource Center, which is headquartered here at the University of Arizona. She serves regularly as a grant reviewer for the NIH, Department of Defense, and other federal, state, and international funding agencies. And Dr. Krupinski has been doing research and publishing scholarly on telemedicine papers for over 25 years. She frequently commutes virtually between Tucson and Atlanta. And Janet Major, she is our Associate Director for Innovation and Digital Health and has worked at the University of Arizona for over 30 years. She's been with the Arizona Telemedicine Program since it began 25 years ago. And Janet is an expert on the planning, development, and installation of teleconferencing, telemedicine equipment used in rural telemedicine sites, as well as training healthcare professionals in the effective use this equipment for both clinical and educational applications. Among the many boards she has served on, both statewide and nationally, she has served on the United States Distance Learning Association for the last 10 years, representing the telehealth constituency. She's president emeritus and immediate past chair. So with that, I'm going to stop sharing here and we will get Dr. Krupinski started. And I will get some more information put into the chat. And again, if you have any questions, please put them in the chat and we can address them. And Dr. Krupinski, we're ready to go.
Thank you so much. Let me just bring up my slides. So good evening, everyone, and welcome. And thanks very much to Melanie for putting this all together. She says that we were on the committee, but she really is the driving force behind it. So I'm going to talk a little bit about how to incorporate telehealth to build relationships with your clients for positive outcomes, because that really is what it's all about. Well, let's start out and kind of find out what are people interested in and what have they have been interested in telemedicine. This was a survey that was done last year. So as COVID was going on, and asking people, what would they go see providers for? What are they interested in? And the top three really don't surprise me at all, and I hope they don't surprise you. I mean, allergy, ears, nose, throat. Got a sore throat, sore ear with the kid. Let's go see what the doc says, but let's do it virtually. Routine preventive visits, mental behavioral health counseling therapy, one of the most widely used applications. And then you've got sort of that middle tier there of some conditions that are less likely to, people want to see their physicians, for example, for GI, stomach related issues, for pain management, arthritis, and eye related issues. And on the bottom row, sort of less common, and I don't know if it's because it's less well known or people don't need those services as much as they would, for example, ears, nose, and throat. But physical occupational therapy is there just about 20%, which I think is interesting, and it's probably grown since that point, since COVID has kind of changed things. Some of the ones down at the bottom make absolute sense that you probably really should go see a physician for respiratory, urgent care, heart-related things, and so on. And I think people are still kind of afraid of the virtual dentist, even more so than the one in person. Now, when they ask people what's going to help them decide to do a telemedicine visit, there were some interesting answers, and these are interesting from the point of a provider, so you can create a practice, a virtual practice that incorporates these things that clients want. Well, one, they want easy to use technology. One button, make it work, simple, easy peasy, and that's what they really want. Nothing complicated, not a lot of steps to get through to get to the point where they see the provider. They want to be told that telemedicine services are an option. There's actually been a lot of studies recently that there's significant bias, kind of widening the digital divide and widening cultural barriers to some extent, because providers are not often enough offering telemedicine and services because of intrinsic biases that they may have against, for example, elderly people or people in rural areas, thinking they may not have or be able to use the technology. They want online scheduling options, and kind of, in the generation that it is, they want immediate gratification. They want to go online, book the appointment, and see that provider in about 5 minutes. Other things that are up there, but not as much as these four: understanding what their insurance covers. I was kind of surprised by that. Having a secure and private platform does not interest as many people as you would think. Ability to see the same provider from visit to visit is not as important, and so on. So these are a lot of the reasons that would help people make that decision. Some of the really key successful aspects of a telemedicine program that you should think about as you're setting up or transitioning into a more full-blown version of telemedicine. Obviously you got to have a business plan. You've got to think about the reimbursement model. You got to make sure you have the proper licensure, the proper technology, and someone who really wants to do it. These are sort of the basics of really any business enterprise. From my perspective, I think you really need to concentrate on how well you're going to integrate your practice into the existing practice. Where does virtual fit, and how do you make it fit? There's all sorts of models out there: hub spoke models, enterprise-wide systems, service provider, direct to patients, and you have to really tailor your practice to what's best for you and best for your patients. And again, from my perspective, my background is I'm an experimental psychologist. It's all about workflow. And if you don't get the workflow right, if you don't create standard operating procedures and integrate things well into your existing workflow, your electronic health record and so on, that's where you're going to run into trouble. So if you can do that in advance, it really does ease the way to a successful telehealth process. And it's absolutely not about the technology from my perspective. It really is more about the people and how well they can utilize that technology to have a successful encounter. Well, in the world of occupational and physical therapy, what works? An awful lot. Music therapy, guiding people, kids through speech therapy, occupational therapy, rehab, guiding kids through different types of occupational and physical therapies as well. So it really is very amenable to telehealth. And I think that there's a lot of advancements in telehealth. Now, this is kind of my experience with occupational and physical health. So avid skier at one point a couple years ago, level 6 tibial plateau fracture, got some lovely hardware in my leg now. And I was doing a lot of rehab, and I had to do occupational therapy in the beginning to learn how to use and get around on the crutches and so on. And having been through that experience, kind of without the virtual way, I have, a lot of insight and appreciation into what it takes to do occupational and physical therapy via telehealth. It's almost like you're thrown in a room, and there you have two people. There's one in another room, and you're sitting in a room. And in their room, call it your client, they got a bunch of Legos. And it's your job to guide them through this massive stuff and have them build something. And all you're doing is telling them what to do. And it sounds easy, but it's really not, especially if you really don't have access to seeing all of them. So for example, I could say, okay, pick up that green flat piece. No, not that flat piece. The piece, it's flat, it's maybe 2 inches and it's only one row of little dots. It's very complicated when you can't just pick something up and say, here, pick up those rubber bands that you give out all the time. Now do what with it? Well, put it around your 2 hands. What do you mean put it around? Do I wrap it around? Do I just hold it? Where do I hold it? Put it on my feet, on the arch of my foot, on the ball of my foot, under my toes. It really is a different experience to do things virtually. And that's what I mean by trying to figure out your workflow. And you want to do all that in advance because there are certain ways that we're limited in telehealth. There's certain ways we're not. Think about the human factors of it all. We've got 5 senses. When you're in physical and occupational therapy, one of the key ones that's utilized is touch. And unfortunately, you don't have that in a virtual world. So you've got to figure out how to compensate for that and utilize different ways. And mostly it's going to be you explaining or doing visuals with your client on the other side. Vision obviously is the key thing that we're going to have, especially in these real-time virtual encounters. But to some extent, you're limited in your scope or your field of view. You can't always see the full scope of what the patient's doing. They may have to move back from the camera in order to get it across to them. You may have to move back to the camera to show them what you want them to do and so on. So there's a lot of little logistics. Smell is not so important in physical occupational therapy, but it might be as well. So for example, when a client comes in and you can smell the alcohol, or you can smell they haven't taken a shower in 3 days, these are important clues to the patient's status that then help guide you through your session. And that's not available virtually. Hearing obviously is available in real-time encounters, but you lose sometimes the subtleties of somebody's voice, the trouble that they're having doing something because they're not, kind of natural. They're talking to a camera. And so you don't pick up on some of the subtle clues of perhaps pain or discomfort that you may very readily pick up on an in-person encounter. Taste, okay, not so much. But there's that 6th sense, that gut reaction, or the presence that you have with the person where you just know when something's wrong. And you can feel that, just the way you're interacting. And you lose it a little bit on a virtual encounter. You also have to worry about the comfort, the ease, the rapport, the satisfaction, and ultimately the outcomes. But all of that, I think, is related to some of these human factors. Now, a lot of the virtual encounter depends on eye contact, to be perfectly honest. There's all that other stuff you have to do in a virtual encounter with the actual therapy. But making that connection with the patient in the first place is all about eye contact. And we've all seen these people during various Zoom encounters, people with their heads chopped off, people who are looking here, looking there, not looking anywhere in the camera, and they're sometimes the speakers. So you really have to think about, how do I make eye contact? And why is it important? Well, it's one of the most important aspects of human connection and interaction. And it's actually fundamental to something called READ, or the Relationship Establishment Development Engagement Model of Patient-Provider Interaction. There's a skills checklist in the READ model that covers eye contact. And there's a lot of evidence that when you make eye contact with someone, it increases their sense of self-dignity and their awareness that you think they have dignity. What else does eye contact do? Well, when you make eye contact with someone, it helps establish rapport and trust. You're on the same level. You can look into each other's eyes. It helps keep you focused, which is always good. It encourages interaction. There's actually a lot of evidence from fMRI and so on that it facilitates memory and the making of memories, which is important because you want that patient then to be able to go home and do the exercises or the therapy and homework that you want them to do. You want them to remember what it was all about. And doing it virtually, you have to make sure that those memory cues are really there. In person, it's a lot easier to get those memory cues into their brains. It influences likability and attractiveness. I mean, the more you look somebody in the eye, the more likely it is they're going to like you and you're going to like them. It affects emotion, or the perception of emotion, and it makes people feel included. It also allows some for nonverbal cues. So just be aware of where your camera is and look into the camera. We're very tempted to look into the middle of the screen, but that's not where you can make eye contact with your patient. You have to look into the camera. There are, however, cultural factors. Different cultures associate direct eye contact in different ways. For example, Arabs, Latin Americans, Southern Europeans, they tend to make far more eye contact than do Asians and Northern Europeans. It's just a cultural thing. And so you may have to realize that when you're talking with some of your patients. For example, the Japanese actually consider eye contact rude. And people are actually taught to look at the Adam's apple rather than looking people in the eye. And it's very much affected by social rank. You never look someone in a higher rank than you in the eye. It's just absolutely avoided. In general, and this isn't surprising to most people, especially women, women make more eye contact than men. And this one shouldn't surprise people either. Up until about 4 to 6, 6 to 9, eye contact develops readily, and kids are more than willing to make eye contact. They do it all the time. And then, gee, what a surprise, from about 10 to maybe 15, they don't make eye contact because they're teenagers. But then after that, it increases again into adulthood. So again, you might have to take that into account. This is a really great document. It's called the Culture Card. It's a guide to build cultural awareness with American Indian and Alaska Natives. And it really goes through some of the considerations that you really need to understand sometimes in order to work with clients from these populations. It's a 2-page flyer in a sense. We can get it to you. It's one of the resources. And I encourage you, if you have clients from these backgrounds, or really any background that, underrepresented minority, it really is, this is for Native Americans and Alaska Natives. But I think what it's in this document really applies when you're working from anybody from a culture that's different from yours. Lighting is incredibly important. Janet can go into this in more detail, but if you're going to make eye contact with someone, you got to be able to see them. The guy there in the bottom left-hand corner, he's in the dark. He's got very bad lighting. How do you make eye contact with that? Or when somebody like the guy in the upper right is sort of this Darth Vader, half good, half bad person, you don't easily make eye contact. So you want to make sure your lighting is amenable to making eye contact as well. Some tips if you're doing it by, Zoom or video or whatever product you have, just some tips for you and your clients. And it's often helpful to send some of these useful tips to your clients. And we have fact sheets that you can send to your clients that illustrate some of this. But, don't move around. If you're using a tablet or a phone, don't just carry it around. Put it on a stand, have it sit still, and have it so you're not always looking down onto it or moving or holding your phone here and people are looking up your nose. Test your microphone and speakers before you start. Consider headphones if you don't have a good quality system or if you got a lot of background noise. Check your video, make sure you look okay. It's not vanity, it's just you want to make the best appearance for your client. Introduce everybody at the beginning. Ensure you have a good workspace, nothing in the background. And make sure you can practice some of the features that are available in some of these platforms so you can best utilize them to interact with your patients. Only record if necessary and tell your client if you're doing it. And practice. I think having practice and fake sessions, for example, with people in different rooms and utilizing the technology, use your colleagues, use your friends, use your family, but work through some of the workflows before you actually work with some of your clients, just so you know what's feasible and that you're able to convey your meaning and instructions to them in an easy and effective manner. And it really is important, like I said, to practice. The first minute is absolutely critical. You want to appear on the screen immediately to your client in a professional, confident, and authentic manner. You don't want to lose them straight away. If you come on and you're anxious, you're nervous, you're unsure, you're not sure what to do, your client's going to be like, do they even know what they're doing? And they're going to say, no, sorry, I don't want to do this. So always be warm, open, respectful. You want to be as participatory as possible. Get that client to interact with you. Again, when you're in person and you're guiding them through their exercises, their rehab, whatever, it's a lot more interactive because they have questions and you're right there, hands-on. You can sometimes feel when they're doing the wrong thing and certainly see it, but you have to get feedback from the patients in the virtual world. You also want to set the stage and do some pre-education about, what are their expectations? What are your expectations? What are the limitations of what you're doing virtually? What are the follow-up processes? And always ask, Q&A. Do you have any questions? Make sure you got a great environment, minimizing distractions. Make sure you got good light, the needs for the activities. Send your client, the rubber bands in advance and any other tools they might need. Have them with you so you can show them, here's the green band. This is what you're supposed to do. It's this level of, resistance. Here's the yellow one. This is how resistance. Do you feel how it's easier or harder? If you lose connection, make sure you know in advance who calls who. How do you reestablish that connection? Make sure you're culturally competent. Sometimes it actually helps to take into account the gender, race, ethnicity, age, sexual orientation of your clients and see if you can match them with providers. Some clients are more comfortable that way. Clarify roles and expectations, especially if you've got more than one person in the room with you or with the client. Make sure everybody knows what their roles are, especially, caregivers and parents and so on. Review your prior history with them. Look for teachable moments. Again, sometimes it's a little harder on video, but look for when they're doing something wrong or doing something right. And then, hey, we can learn from this. Let's move on. Talk about post-visit communication. How often should they call you? Can they call you? And again, always be aware of escalations and potentially know where the emergency room contacts are for that person, because you can't just call 911 if they're 50 miles away in another county in another 911 system. So know what their emergency contact is. Be warm. Always try to smile as much as you can. I think you got to oomph it up a little bit virtually in order to make things happen. And establish that rapport, confirm the patient can hear and see you, allow for extra pauses after you say something or after the patient speaks, because there's this imperceptible time lag and they may not quite be done. So give it a second and then kind of jump in. If you got to look away to write things down, tell them what you're doing. You're not ignoring them, you're just looking away to take some notes. Identify why you're there, what your priorities are. Again, identify if anybody else is in the room and keep asking them, is there anything else? Are you sure you got it? let me see you do it. And let them show you that they know they've got it. And again, consistently convey empathy, be an active listener. And you got to kind of ramp up your listening skills as well. Again, because you may not get some of those subtle visual clues about that they're having trouble with what you're trying to get them to do. Ask them if they've ever seen a doctor on the phone or computer, if this is your first time encounter. Explain why you're doing it via telehealth. Sometimes it helps to actually confirm that you're really in real time, that you're a real person. Maybe point out to them, hey, I like your blouse. And then they get this, oh yeah, it really is real. And we are doing this real time. It's not just some kind of recording. Discuss security and privacy if you have to. Reassure them also that this session is not being recorded and not going to be sent out over the internet. Some clients are worried about that. If you do record it for some reason, you should get their consent. And establish your visual context. Maybe ask them if they'd like to see your environment, and then move your camera around just so they can see where you are. If you're at home, tell them I'm at home. This is my living room, or this is my workout room, and I'm kind of welcome you virtually into that space. Have a closing checklist. So at the end of your encounter, you summarize the plan. You're going to go home. Remember, you're going to do the this pose 10 times, 3 times a day. You're going to use the green resistance band. You're not going to use the yellow one. You're going to do the yellow one for this exercise. Reinforce any actions that they're supposed to take, like increasing activities, changing their diet, complying with medications, whatever. Always, again, review and ask questions and answers, and provide them on guidance on what to watch out for should the problem worsen. You tell them to do, 3 reps of 10 each, and they go home and they do 10 reps of 3 each, or, they do it for 3 hours and all of a sudden they're in more pain than they started. Well, tell them what to look out for and what not to do. And then offer instructions on how they should contact you for follow-up or concerns. Ton of great resources. Melanie's done a great job of collecting a lot of these, putting them on the website. But there's a lot of professional societies, the American Medical Association, the American Telemedicine Association, the Telehealth Resource Centers. We have got so much information and resources. It's just amazing. And if you have questions, you reach out, and 10 to 1, somebody's going to have the answer for you. So in summary, technology really should not be a barrier to establishing rapport with a client and being able to conduct an effective PT or OT encounter. The tech tools, I think, can facilitate and often enhance what you can learn about the patient and how you can help them. Telemedicine does, however, create a very different work environment, and it's got devices that you've got to interact with, that your clients have to interact with. And so you've got to, like I said, practice a little bit in advance. Ton of resources with tips, helps, methods, and protocols. So please go ahead and use them. And finally, thank you very much.
Excellent. Thank you, Dr. Krupinski. As Janet's getting all queued up, you're muted. If we have any questions for Dr. Krupinski, please use the chat feature and go ahead and put them in there. We've had one participant list that the Arizona Occupational Therapy Association actually has a monthly telehealth special interest section for support to therapists as well. We can get that information out and some of those links when I do a follow-up email for everybody that's attending today. And again, Dr. Krupinski's information is on this slide, and her presentation is within the materials link as well. All right, Janet, are you ready?
There's another comment there
yes.
that it's more common in pediatric than it is with adults. And I think that has to do with the fact that, kids are kids. They're just more receptive to just about anything. And it's almost like being on TV for them.
Right. So. Excellent. Thank you very much. All right, Janet.
Yes, I'll get queued up. I need Dr. Krupinski to stop the share. And what I'd like to say by way of introduction is I would really like to thank Dr. Krupinski, and I really want to thank Melanie for bringing us all together. This is really great to have this fantastic program, and I'd like to thank really the entire program committee. I'm very excited about having the opportunity to be here today. So what I have to say is a little bit of a different spin from Dr. Krupinski. She's definitely more the psychologist, the scientist. My area of expertise is, my degree is in telecommunications, and my major area of emphasis was producing and directing. So I'm more of the lights, camera, action Hollywood girl. And I will be reiterating a lot of the great advice that was just shared, and as well as some great resources and hot tips that I hope you'll find helpful. So I think of effective communications technique, and I think about the telecommunications connectivity and the technical protocols that are so important to complement the clinical protocols, and how we can best use technology to communicate. How do we put the tele into what we're doing, no matter what we're doing? Because I think a lot of what we do isn't just literally medicine at a distance. I think about telehealth, and I love that word because to me it encompasses all of the education that we do as well. So we've known for a long time, these are the two things that we need to make telemedicine and telehealth happen. The thing that's really incredible right now is people realize that if we have those two things, we now have access to healthcare. So you have to have the broadband, you have to have some type of connectivity to make this happen. And we're very fortunate here in Arizona that we have a state broadband director, and we have a plan, and we have a backbone. Now, we still have to accommodate for places where there isn't very great connectivity. How can we get technology and bandwidth to patients so that they can be in their home? People would love to be in their home, but they may never own a cell phone or a tablet or a computer. So we've been working very hard with our state libraries to deliver and install resources like that so that people can go to the library and check out these devices and get connected. And whether that's for diabetes work, same thing for PTOT, support groups. You know, there's so much that you can do if you only have that connectivity. So many of the resources that we share today are also found on our website. We have a lot of experience serving all of the states that you see there, but all of the templates, all of the things that you would need as far as just seeing what some best practices are there, and no matter where you live here in the United States. And of course, you're welcome to visit any of the TRCs. There's a TRC that serves you, and some have very special areas of interest. Our specialty really in many ways is training, but we all are a collaborative network. One of the TRCs uses their HRSA federal budget to specifically hammer on the technology. So they're a great resource, because what they do is, if you're shopping for a stethoscope or a camera or different devices, software, platforms, they've done white papers, they've done shootouts. And so they can tell you from a very strong data perspective what their findings are, and will not tell you what to buy, as we would never either. But it's a really great way to get that information in a way that, you know, you're not scheduling your own shootout. So if you do want to do so, they have great templates for doing that. So in technology, there are different resources that I've shared with you today through your handouts, as well as through this PowerPoint. But when you think about how to shop, probably the most important thing is that third point: interview what people have been doing in your neck of the woods and what they're using, what are their best practices. The important things to remember about pricing and technology is a lot of what you can buy off the shelf is really pretty fantastic when you think about it. We can use an HD off the shelf Logitech camera. And if you're in the market to buy one, buy the one that has a little privacy window. I love being able to say, welcome into my home. And I know that when that's closed, nobody's there. Nobody's allowed until I invite them. And these are things that are really important to have control over the audio and video. And these things really need to be easy to use. If you're uncomfortable, awkward, you're going to look even more so. And you really do need to be independent and often operate it yourself. If you're also thinking about pricing, another consideration is how much network support does something take? If it's just a few clicks of the mouse to open an email, as opposed to building a temporary circuit from point A to point B, well, then you know that you can support it yourself with very little network engineer support, even though they're great guys. And they're great careers of the future when you think about it. To be a network engineer that specializes in video conferencing is pretty priceless, just like the job description of a telemedicine site coordinator. Maybe you would have access to that in your clinic, and that's someone who's doing like the pre-production and the scheduling for you. You'll have a lot of different levels of support. And you may have to consider when you're using technology, especially if you have access to one of those beautiful telemedicine carts, they're still very useful. They often have hardware video conferencing devices as well as peripheral cameras, but they often also require contractual agreement and a maintenance fee. So if you're budgeting to buy stuff, you have to think about these things. And in the end, it has to be efficient. And this is something that was also reiterated by Dr. Krupinski, and it's really one of the bottom lines. This shouldn't be just because it's really cool stuff. You really need to think of it as a tool that makes you more efficient at what you do, and it shouldn't change the way you do business necessarily. It shouldn't be anything cruel or unusual. It should just be another efficient way to meet with your patients. And it just requires a little bit more time with the lights, camera, action, taking a look at that. So here's a resource that I've done. It's a technology review that's 2 years old. The ATA exhibit hall will be open again in May. So if you'd like to visit back to our website, I would like to do another exhibit hall review and see what the latest and greatest is, because there's always really cool stuff. And here you can click around on this resource guide to do some shopping if that's something that you're interested in doing. So this is where we are, our hub site at the Arizona Health Sciences Center, and we practice the art of telepresenting. We do scenarios so that we do have folks participate in a way in which they can be the patient, they can be the presenter of a patient who could be really from many different skill levels. Here in our prisons, they require an RN. And then they practice being a specialist. So when we teach telegenetics, that would be the patient, the telegenetic counselor, and maybe the geneticist on the other end. But to see those three roles is a really great rounded education in a way that teaches you what it's like, because it really is reality TV. We don't want to just look good. We want to be medically accurate, right? We need the right lighting. We need the right camera. We need the right camera technique, and not, take pictures like my mom with half of someone's face. You need to frame the person and do the things you don't usually think about that much when you, and it is an art. It really is an art. So here you see our training facility where we have a mock patient clinic. We have the telemedicine site coordinator spaces where our clinical case workflow included pre-registering the patient, creating a chart. So when the specialist arrived to go to the specialty clinic on the far right with the big 80-inch monitors, the specialist would have an actual copy of the chart. They would have a laptop on the desk with access to the patient medical record. And that was the way it worked for us. And so what your workflow is should be obviously based on what parameters you have. Much of your technology and software may have already been decided for you, depending upon where you're working. But there are ways that you can do the best with what you have. And that's what I hope you take home today. So the lights, camera, action part, one of the most important things is the background. We never think about the background, right? If we're here at our home, we have to think about what's hanging on the wall behind us. That's one thing that I really learned from those genetic counselors. You can't be counseling patients who have fertility issues with beautiful pictures of your family in the background, and they'd never thought of that. The things you learn just from being in the environment. What I learn is if I record video or take pictures, I'll realize how many little sticky notes I have everywhere reminding me of things. Well, that doesn't make me look very smart. So you need to be very aware of how you're presenting yourself. If you're going to be doing two-way video conferencing, we often can use just the built-in camera on our laptop. But if you're just accessing patient data, it's a secure website, but you need to be sure that whatever you're doing, whether you're in at your desktop or in a beautiful video conferencing facility or at home, or if you're conferring with a patient who's bedside, you do need to think about these things, and you need to help your patients think about these things. We have an ostomy support group in which our engineer tests to the patient's home with them using their own devices, in a chair that's comfortable for them, in a place where they can make sure they have a good background so that they can participate in the conversation, and to make sure they know how to turn it on and off their microphone so they don't ruin it for everybody. Your information you're communicating obviously needs to be medically accurate. I love the fact that video conferencing in this way, in these echo cancellation microphones, forces us all to be better listeners. If two people are speaking, only one person, nobody communicates, right? One person should be speaking at a time. Why Elizabeth suggested that pause. And that's great, because often we get into those uncomfortable, awkward situations where you're going, and you don't know who's supposed to speak. So it's really important that you pay attention to that type of dramatic pause, as it were. The patient benefits from the undivided attention of the clinician, and this is really great. You know, you get to see your doctor and you don't have the babies crying in the background and everything else happening. So you do have the opportunity to have what would be maybe a more clear and concise conversation and better communication if you eliminate all those distractions. And of course, it maximizes all of our time. So you have to have the elements of production to do this. Things that have already been mentioned, you think of electronic stethoscope as just another microphone. So those protocols are important. Looking at the angle of your lighting, you don't want a window or a door behind you. The layout of the room becomes very important. And I've got a couple of examples I'd like to show you. Make sure you're looking good. And if you're home, this is a big problem for me. 5 dogs, 5, count them. They're not my dogs, they're my children's dogs. But you have to be sure if you're going to be video conferencing, you have to consider all of the things that would be distracting the people that you're teaching. So to do medicine at a distance, here's that definition of telehealth that I love so much. And it's interesting because when people think about telemedicine and telehealth, they think about the fancy robots, right? And the really high-tech stuff. But often you can do everything you need with off-the-shelf technology. And this is a setup for telepsychiatry. And the biggest challenge was getting the contract signed, because this is all off-the-shelf technology that does an incredible job for behavioral health. That echo cancellation microphone, that Logitech camera off the shelf, computer with software installed, HIPAA compliant, of course. And then the big challenge in this room was every wall had a door or a window. So it was necessary to purchase a nice backdrop. Now, when we painted our rooms in the past, we had a template for our telemedicine rooms. Flat, light blue latex paint. And this is a beautiful color. And it's also very professional. Of course, you put your logo on the background. So now everybody's used a lot of these different video conferencing softwares and hardwares. But the thing, of course, you have to ask first is it HIPAA compliant? And you want to be sure that now that you are seeing patients in this virtual world, that you're very aware of your body language and how you communicate both verbally and non-verbally. And the best way to get better is to practice. And one thing that we do at the College of Medicine is we actually video record our third-year medical students and put them through a practicing clinical medicine clinic where they're expected to diagnose, and they're also video recorded. We also record and give feedback in our telegenetics. You know, you can really learn a lot from admiring someone's empathy or saying, you know, I don't know if you realize this, but you cross your arms across your chest a lot. It's nice to have that type of feedback from one another clinically. And it's also really just the best way to count your ums and realize how you present yourself, because that's really important in this environment. And this is how you want to look. You really want to be professional, right? And this is how you don't want to look. You need to be aware of what you're wearing in a way you never were if you know you're going to be on video. You don't want to wear a red shirt. You don't want to wear those big bangly earrings. You want to be sure that you are very aware of things. If you know you're going to have a teleclinic that day, well, then make sure that you wear something that isn't going to be too busy, or stripes, and HD cameras are very forgiving, but you really want to, again, eliminate distractions. These are like distractions, right? Use an agenda and facilitate introductions. You want everyone to introduce themselves in the room. Otherwise, you wouldn't know who that man is. Is that her husband, her son, her father? And make sure that you do ask people if they ask questions. I think people often have to be invited. They might feel a little uncomfortable, but if you ask them, do you have any questions? They might have a burning question and they might not ask unless they're invited. And be very familiar with that equipment. Practice, practice, practice. And even if we've tested and connected with the place hundreds of times, if we're doing clinic, we connect early. We test the day before and we connect early. That's your insurance. So we're going to take a look at this video at the end of my slides, because this is a great resource for you that was produced by the Hawaii Department of Health Genomics and work with us in the telegenetics training that we do. It's been a wonderful partnership. And it's a great resource and tells you a little bit about all the things that we talked about today. They also have a nice orientation video for patients, and that can be really beneficial as well. If you know you're going to be offering telehealth services, you can make just a cute little 3-minute video with avatars and say, this is what a telehealth visit looks like. So if you know you're going to be having patients do that, they can get a little orientation before the actual encounter, because we're going to be doing this more and more often, and it's going to keep people in their communities, which is great for everybody. So great summary would be to take a look at those best practices, think about technical protocols, clinical protocols, do mock patients and training, network with people in your neck of the woods and find out what's going on. That really is an amazing resource, just like you're doing today. Unfortunately, we can't have, 70 microphones open or however many people are here, but we really do want to network with you and be here for you. And I want to zip through a couple of more resource slides. One resource that I think is really great is the ECHO program, if you haven't heard of it, and they are really worldwide and do great best practices sharing and information sharing amongst rural clinicians. And we've produced a couple of ECHO programs successfully here in Arizona. One was with telerheumatology. Apparently we only have 2 rheumatologists in the entire state, but it's really great for primary care providers to learn more about rheumatology so they could de-identify patients, participate in this program, learn a little about rheumatology, and get some CME credit. And I would imagine in the future, this will be billable, and there might, this is absolutely an important way in which we can extend healthcare and improve the knowledge base. We also did a Neo Echo, which was an amazing project that I hope gets funded. And it's a very smart nurse, doctor nurse, who developed a scale to diagnose NICU infants that saves lives. Well, isn't that great to share in an echo format? So I would love to also share with you in my resource slides. I know you have this because she's great. She brought us together. But any questions that you have with regards to CME, Melanie's a great resource. We should have read her CV as well. I hope that's part of your materials, educational materials. And I wanted to share, if you are interested in more information about the clinical case presentation or clinical case workflow, back to that telepsychiatry model in Cells, Arizona, their clinical case workflow was such that their equipment that I showed you was installed in the social worker's office. So if a primary care doctor wanted to refer a patient for behavioral health, they would immediately be referred to the social worker who booked their room and did the testing and got the equipment up and ready for them. So it's different for everybody, everywhere. Obviously, prison sites have their own protocols. So developing your protocols becomes very important. So there's a great video that walks you through that. And a couple of lessons learned. If you really want to be efficient, then you schedule your clinics on a regular basis. Try to do it just like in person, as I said. Have somebody trained, but also have a backup. It's a shame when you have to cancel a clinic because somebody is not available. Have your own workflow chart. And the best practice standards and guidelines you can find here on the American Telemedicine Association website, as well as our TRC website, or absolutely look us up and we'll help you find whatever it is you're looking for. Now, the most important thing to think about, I think, and I would imagine we would all agree, is that we're all very different people. We do have to be culturally sensitive in this. And I think about technology as something that should really be considered as a means by which we should be culturally sensitive. And when you think about it in terms of technology, that also means age. Not everybody has the same ability or embraces the technology. The other thing we have to consider is language. We serve people who speak many different languages as their first language. We serve here in Arizona people who support a large agricultural economy, people who need to stay in their hometown. I think that's why we've had the opportunity to invest so much in our infrastructure, and learning things about diabetes and maximizing the use of PTOTs is absolutely got to be part of our future too. So I wanted to share with you a little bit of information about physical therapists and the compact. Now, as you know, nurses have a compact and they're pretty smart. They're up to 39 states. Physicians, it's a lot harder for them to work out a compact. And this is often applied to people who are, working on matters in which they have a common concern. True definition of a compact. With physicians, I think they really have a problem with regards to the medical liability, and many of them have served on the medical boards of their state, and their state likes to discipline their own clinicians. There's a lot of reasons why I'm sure it's been difficult. But the thing that's really great is this is happening for PT, and this is also happening for occupational therapists. And Melanie told me, late breaking, 10 states are now on the slate. So that's great news. And I would like to share with you my contact information and stop sharing this so that we can get to the interaction important part and answer any questions that you have. I know that we've thrown a lot at you. It's a lot of resources. And again, thank you, Melanie, for coordinating all of that. And thank you, Chris Martin, for putting this all on the website and building that resource website and being here to help us with the program today.
So we've had some questions in the chat. Thank you for putting them in there. And both Peggy and Elizabeth have been responding to them. I've got, go ahead and keep putting the questions in there. I've got a great little video I'm going to share. It's telehealth best practices, is what Janet was talking about. That was done by the University of Hawaii, the Pacific Basin Telehealth Resource Center. They're out in Hawaii. So let me go ahead and get this queued up here. It's only 4 minutes, and it's quite informative.
This video is to give you some basic tips about how to conduct a telehealth session using best practices. First, let's talk about your environment. What is behind you when you're on camera? It's best to have no doors and windows behind you, as they can be distracting for patients and could cause an interrupted session. A blank wall that is a neutral matte color works best. If you have any shelves visible, make sure they are not cluttered. You can always pull a screen or curtain across a door or wall to hide what's behind it. We want your surroundings to look professional. How is your lighting? Make sure what is seen on camera is well lit. No one wants to see a shadowy figure giving them information. Use extra table lights if necessary, since fluorescent overhead lights are not flattering. Try not to have a window or other light source directly behind you, as it will cause you to be backlit and make it difficult to see your face. How is your equipment set up? Just like an in-person visit, it's good to make as much eye contact as possible during a telehealth session. To simulate this, you may have to raise your laptop, tablet, or monitor with some books so that the webcam is positioned around eye level. Before each session, make sure that your face is relatively centered within the screen so that the patient is not just seeing the top half of your head. You may also want to use a noise-canceling headset if there might be any ambient noise around you. If there is a chance that someone might walk into your room while you are doing sessions, remember to put a sign on the door to not enter. Try to reduce sounds from others, including children, pets, cell phones, and other distractions, as much as possible. It's always good to look professional, especially on camera. Limit wearing patterns, as they can be distracting. Don't wear noisy, big jewelry, and check to see if there is any glare off your glasses. Many people who do telehealth also wear a lab coat during appointments. Much like an in-person appointment, please do not drink or eat during sessions. If you are going to be using your mobile phone or a tablet, make sure you are not holding your device in your hand, as you will appear shaky to the patient. Do not move or walk around with your device to avoid having your head bob around. It's best to use a stand to make sure that you're stable within the video.
That's my favorite.
Now, let's talk about patient interaction. Since most telehealth sessions are with people you have not met, make sure to introduce yourself and the purpose of the appointment. Some providers even put a sign on the wall behind them with their name. Then make sure to have the patient introduce themselves and tell you if there's anyone else in the room with them. Sometimes you can't see who else is off camera. Make sure the patient can see and hear you well. Ask them at the start of the session. Adjust the camera to maximize eye contact. Whether you're new at this, have done a lot of telehealth previously, or just logged out of this system an hour ago, before you start a new set of sessions, you should always test your connection to the platform. Make sure your internet connection, microphone, and video are working. It's better to troubleshoot before you're on with a patient than during a session. Ending the session. Remember to reiterate your recommendations to the patient and provide documentation for your records and the patient as needed. If you can, try to give the patient information about who to contact if they have additional questions. Finally, check that you have successfully logged out of the session completely. For more information, you can go to the National Consortium of Telehealth Resource Centers at telehealthresourcecenter.org and find the center that covers your state. This video was created by staff of the Hawaii Department of Health and Western States Regional Genetics Network in collaboration with the Pacific Basin Telehealth Resource Center, funded by the Health Resources and Services Administration.
There we go. That was a great resource as a quick, short, informative video on getting your own session, getting your own space set up. There's also another video that I can share in an email that's actually for what the participants or what your clients and your patients can expect. It's done by the same group. It's about 7 minutes, and it's called What to Expect from a Telehealth Visit. And I can add that into the resources for my thank you email to everybody. So it looks like we had some more questions going on in the chat here, and some of them are already getting addressed. Thank you very much. And if there's any questions that we don't get addressed, we'll have a transcript. I'll be able to go back through and take a look at it and see if there's any information that I can send out directly to those of you that had any questions in here. Let's see what else. And it looks like we just have a few minutes left. So any other questions?
The interesting train is the one here at the end about whether, sort of the liability issue almost is when you've got somebody who is handicapped or is in a situation where, they need the help and so on. Do you want them, is there regulations or best practices that say you've got to have somebody there with them in the room? I haven't seen anything along those lines, but it's up to you as a professional to decide, one, is telehealth appropriate, feasible for that particular client? And if you think it is, and they can do it on their own, great. If you think it is, but they would probably need somebody else there in the room, then that's something you've got to consider as well. And that's sort of the utility of an initial visit, or having an established relationship with the patient always helps too. But find out who that other person is, and then you've got to be able to judge their capabilities. I mean, if you're dealing with an 80-year-old person who's, going through rehab because they broke their hip, and their caregiver is their 82-year-old spouse, they may not be the most appropriate person because they may not have the body strength to help should something happen. So it's kind of up to you in an initial session to kind of figure out, what are going to be the limitations with this particular patient, because it's not one size fits all, unfortunately.
Right. That's important.
That's some great information, Dr. Krupinski. Thank you very much. Looks like somebody made a comment. Yes, and the caregiver needs to understand the HIPAA information as well. Peggy, would you like to chime in?
Well, she's getting her. I think it's like the caregivers to sign the HIPAA release never said they had to read it. And nobody ever does. You walk into any doctor's office. How many of you have signed that form and never, ever read what it says? Now she's got her audio.
One of the things that I tend to do is to ask at the start of the visit to make sure that I have verbal consent for the telehealth session. And that way, I think it provides a bit of HIPAA compliance, and that they know what the implications are. They always have the right to cancel the visit and to select an in-person visit, or to switch to telephone as well.
You're absolutely correct.
That's
All right,
interesting.
do we have any other questions for our group here? We're getting right down to the wire. We filled our hour. I'm so excited. And it looks like everybody has stayed on as well. I'm going to give one more plug for our session next Tuesday evening. It'll be session 2 of our occupational and physical therapy webinar series. And it's going to be with Luke Davies. As I said before, he's a physical therapist down in Australia. They're 18 hours ahead of us. So my afternoons are his tomorrow mornings, and we've been emailing back and forth. He recently he did an e-Delphi study, and it was actually selected as paper of the year in the Journal of Physiotherapy, which is the official journal of the Australian Physiotherapy Association. And he also told me that there's going to be a follow-up paper. It's going to be published in April, end of March, beginning of April or so, and he's going to be sending a copy of that to us as well. But fascinating information of creating a framework for physiotherapists using video conferencing. So please check our website and sign up for that. That's next Tuesday, March 1st at 5:30 p.m. Arizona time. And looks like we're getting right at 6:30. So again, thank you to Elizabeth Krupinski and Janet Major and Peggy Stein for joining us. Chris is in the background who helps keep all the technology moving for us. And everybody, thank you for joining us tonight. And please do the, I'm going to go ahead and put my evaluation link in the chat right now here. Please be sure to do the evaluation to request your educational credits. There it is right there. And it'll also populate another browser window, which is going to be in the background from the session. So with that, I'm going to sign off and say good night, everybody. Thank you for joining us. And look forward to seeing you at a future session.
Bye.
Thank you, everybody.